Imagine being able to prevent a heart attack before it happens. Sounds unbelievable, right? But what if I told you that your body has been trying to warn you all along? The problem is, most people miss the signs. Some of these warning signals can appear as early as a month before a heart attack, yet they're often brushed aside or mistaken for something else. Picture this: you're going about your daily routine, feeling a little off, but nothing too serious. Maybe you're sweating a bit more than usual, feeling a little more tired, or struggling to catch your breath now and then. You tell yourself it's just stress, lack of sleep, or maybe something you ate. But what if these small, seemingly harmless symptoms were actually your heart sending an SOS? Today, we're uncovering 6 early warning signs of a heart attack. You might recognize some of them, but the last one, it could be the most surprising of all. Cold sweats. Have you ever suddenly broken out in a cold sweat, even when you weren't exercising or the weather wasn't hot? It's easy to brush this off as nerves, anxiety, or just a fluke, but it could actually be a warning sign from your heart. When your heart struggles to function properly, your nervous system kicks into gear, triggering your sweat glands in an attempt to cool the body down. It's like your body going into emergency mode, trying to compensate for something that's going wrong. If you often find yourself drenched in sweat for no clear reason, especially if it's accompanied by dizziness or discomfort, don't ignore it. Your heart might be in distress, and it's time to listen. Shortness of breath. Have you ever felt out of breath doing something that used to be easy? Climbing the stairs, walking across the room, or even just talking for a long time suddenly leaves you gasping for air. This could be a red flag. Shortness of breath can occur when the heart isn't pumping efficiently, leading to poor oxygen circulation and fluid buildup in the lungs. This makes it harder to take deep, satisfying breaths. Some people describe it as feeling like they can't get enough air, or like they're suffocating for no apparent reason. If you notice this happening more often, don't assume it's just being out of shape. It might be your heart struggling to keep up. Sleep disturbances. Struggling to fall asleep. Tossing and turning all night. Waking up repeatedly with no explanation. You might not think of sleep problems as being related to heart health, but research says otherwise. When blood circulation is unstable, your body senses the change, making it difficult to fully relax and fall into deep sleep. Some people even report waking up gasping for air or feeling restless throughout the night. Studies have found that chronic insomnia can increase the risk of heart attack by up to 27%. If your sleep quality has been declining, it's worth considering whether your heart could be playing a role. Persistent fatigue. We all feel tired sometimes, but what if that exhaustion never seems to go away? Imagine waking up in the morning already feeling drained, struggling to get through the day, and feeling like no amount of rest can bring back your energy. Chronic fatigue can be a sign that your heart isn't pumping blood efficiently, leaving your organs and muscles deprived of the oxygen they need. This is especially common in women, who are more likely to experience extreme fatigue in the days or weeks leading up to a heart attack. If you're constantly feeling worn out, even when you've had enough sleep and haven't done anything too strenuous, don't ignore it. Your body could be trying to tell you something important. Bloating and indigestion. Most people think indigestion and bloating are harmless, often blaming them on something they ate or stress. But what if I told you that your upset stomach might be trying to warn you about something far more serious, your heart? Yes, that uncomfortable fullness, burning sensation, or constant burping isn't always a digestion problem. In fact, persistent indigestion could be an early, silent signal of heart trouble, specifically a warning sign of a potential heart attack. How does this happen? It all comes down to blood flow. Your digestive system relies on a steady supply of oxygen-rich blood to function properly. When your heart isn't pumping efficiently, whether due to narrowed arteries, plaque buildup, or other cardiovascular issues, your digestive organs can become deprived of the nutrients and oxygen they need. This reduced blood flow slows down digestion, leading to symptoms like bloating, indigestion, and stomach discomfort that seem unrelated to your heart but actually originate from it. Even more concerning is that this type of indigestion often doesn't improve with typical remedies like antacids or dietary changes. It lingers, comes back regularly, and feels different from normal bloating caused by food sensitivities or overeating. That's why it's crucial not to ignore unexplained or recurring indigestion, especially if you have other risk factors like high blood pressure, diabetes, or a family history of heart disease. What seems like a minor stomach issue might be your body's subtle way of sounding the alarm. So next time your stomach feels off for no clear reason, pause and ask yourself, could it be my heart trying to tell me something? Chest discomfort. And now, let's talk about the classic but surprisingly underestimated symptom, chest discomfort. Many people imagine heart attacks as dramatic, sudden events where someone clutches their chest and collapses, just like in movies. But reality is often much quieter, and much more dangerous. Chest discomfort doesn't always come in the form of sharp, unbearable pain. In many cases, it feels like a vague pressure, tightness, heaviness, or even mild burning in the center or left side of the chest. Some people describe it as a squeezing sensation, while others feel like something heavy is sitting on their chest. What's truly alarming is that these feelings can be fleeting. They might last just a few minutes, then disappear, leading you to believe it's no big deal. But even brief episodes can signal that your heart isn't getting enough oxygen due to a blocked artery. Moreover, chest discomfort might radiate. You might feel it spreading to your shoulders, arms, especially the left arm, neck, jaw, or back. It's easy to mistake these symptoms for muscle strain, indigestion, or stress, causing many to delay seeking help. Here's the key takeaway: never ignore chest discomfort, no matter how mild or short-lived it seems. Time is crucial when it comes to heart issues. Getting checked immediately could make the difference between life and death. Final note: do any of these signs sound familiar to you? If so, don't stay silent. Leave a comment and share your thoughts. Your story could help someone else recognize these symptoms in time. And don't forget to hit like and subscribe to stay updated on essential heart health tips. Remember, recognizing these subtle signals early on could protect your life or the lives of those you care about. Your heart is always talking to you. Are you listening?